Welcome to the Bladder Cancer Canada podcast. I'm your host, Summer Stewart, volunteer with Bladder Cancer Canada. As the first and only Canadian patient advocacy organization dedicated to bladder cancer issues, Bladder Cancer Canada is proud to provide patients, their caregivers, and families with the support and resources they need to navigate a bladder cancer diagnosis. Through patient support, awareness, and research, our vision is to create a world where bladder cancer is just a memory. While Bladder Cancer Canada strives to support Canadians in their diagnosis and journey, we hope that anyone listening from around the world can benefit from these discussions and know we support you too. As a reminder, this podcast is for educational purposes only and is not intended for medical advice. If you need medical information, please speak to your physician. Today, we welcome Susan Shaughnessy to share her story. Hi, Susan. Welcome, and thank you for agreeing to do the podcast. You have had quite a journey. I look forward to hearing your story.
It's been a long journey, but that's a good thing, I think.
I think so too. So maybe we should start by maybe telling us a little bit about your background, if that's okay.
Okay, well, my background, I have the most important thing, of course, is that I have 5 children ranging in age from 33 to 48. And I have 8 grandchildren ranging in age from 7 months to 9 years old. And basically, when my first 2 children were young, I had done a Bachelor of Commerce in accounting and most of the CA program. I had started working and decided that that wasn't what I wanted to do with the rest of my life. So I left that, and eventually I had 3 more children. And when my youngest was 3 years old, I went back to university and I studied law at McGill. After passing the bar, I started working for the Department of Justice in tax litigation. And while I was working, I did a master's in law and tax law. And I stayed with the Department of Justice for 23 years until January 2021. So I've been retired now for 4 years.
Wow.
So, yeah.
What an interesting career change and career choice. Good for you of taking charge and saying, you know what, this is not what I want to do.
Exactly.
So you've had a long history with bladder cancer, going back over 10 years. Let's start with, what were the first signs and symptoms that led you to seek medical attention and eventually discover that you had bladder cancer?
Well, the first, at the time that I sought medical attention, I did not have a family doctor at the time. My family doctor had left Montreal and retired. So I had a friend who was a doctor, and while I was waiting to find a family doctor, I thought I had bladder infections, urinary tract infections. So he had prescribed antibiotics, and over the space of 9 months, it recurred 2 other times. So when it recurred the 3rd time, he said, you need to see a urologist. So he referred me to a urologist at what was then Hôpital Saint-Luc Hospital in Montreal. And he did a cystoscopy a month after I met him. And he discovered what he referred to as the beginnings of bladder cancer. So about 3 weeks later, one of his colleagues burned it off with laser. And I had a follow-up appointment 3 months later, and there had been a recurrence. So he decided, since there was a recurrence, that he would go and do a TURBT. So he did that 2 months after that. And that's when I discovered that I did have what was then a T1 tumor. And basically, he started BCG right away. I guess at the time, probably now maybe they would not have done BCG, but at that time they did. So that was in January 2013 when I started having BCG treatments. And over the course of the next few years, I ended up having up to 30 BCG treatments, and then had a break from 2017 to 2021. When it recurred, and I started again another series of BCG treatments. So all in all, I've had 45 BCG treatments through the bladder. I also had 9 treatments through a nephrostomy tube, because when it was found that I had, in 2023, I guess, it was found that I had some carcinoma in situ in the ureter. And it was felt that maybe putting the BCG through the nephrostomy tube would take care of that, which was not the case because it ended up recurring again. And I ended up having a radical cystectomy, a nephrectomy, and a hysterectomy last June.
Wow.
So,
That is quite
so
the journey that you've been on.
yeah. I also had, before having that, I also had 4 treatments of intravesical chemo before deciding that it was time to have a cystectomy. Yeah.
Interesting. So going back, when you said that you were having symptoms, your original symptoms, was there blood in your urine? And what made you think it was a urinary tract infection?
It was the same type of feeling, that you would have when you have urgency. And yes, there was some blood in my urine. Not a lot, though. I didn't have, a terrible amount of blood in my urine. But when the analysis of the urine was done, there was some blood in the urine. So it really felt like the symptoms I had had in the past all throughout my life whenever I'd had a urinary tract infection. It was very, very similar to what I had had in the past.
Interesting. So your official diagnosis in 2012 was what?
It was a T1 tumor, but then as over the years, I did have recurrences, and then it was because I ended up having several TERPs, and it became carcinoma in situ. That's what progressed. It progressed to carcinoma in situ. And when it spread to the ureter, it was carcinoma in situ in the ureter as well as in the bladder.
So you had lots of BCG treatments for just direct into the bladder. Let's talk about that first. How did you handle those treatments? What were the side effects of those treatments?
Well, I was lucky that I didn't have the flu symptoms that some people would have. I did have a lot of bladder irritation. At one point, it was so bad that in my second series, after the first 30 treatments, and then I had a break, and then I started again. In that series, at one point, we had to delay the treatments because my bladder became so irritated, I couldn't even walk around the block. Really, it was very, very irritated. But on a regular basis, what I would do is I would take a day off work the day of the treatment, obviously, and I would work from home the next day, but then I would be able to go back to work 2 days after. I would say the biggest side effect was really the irritation of the bladder, which is something I don't have now that I've had a cystectomy. I'm actually more comfortable now than I was,
Right.
Obviously, I have a bag on my stomach, but that's really, other than that, I feel more comfortable without my bladder because it was so irritated after all those treatments.
Oh dear. So then you had a treatment right into your ureter. What were the side effects and how did you handle that?
The side effects of that were similar to, because obviously it goes from the ureter into your bladder. So the BCG side effects were very similar. It was a bit of an inconvenience, I'd say, having a nephrostomy tube. You couldn't get it wet. So I had it from the beginning of June till the end of October. So all throughout the summer, I couldn't go in the water. There were many things I couldn't do. So that was really the biggest inconvenience. But I'd say that the side effects of the treatment were very similar. They would drip it through for 2 hours very slowly, because obviously the ureter can't hold the BCG the way the bladder can. So it was a 2-hour treatment, as opposed to just being inserted into your bladder and holding it for 2 hours. So it was a bit of a longer treatment, but the end result was the same. The bladder irritation was the same. So it was very similar.
Yeah, that was my next question. Did you experience that bladder irritation?
Yes, for
Yes.
sure. For sure.
So then you mentioned that you went on to have chemotherapy.
I had after the next series of the next cystoscopy I had, and the doctor I had actually changed hospitals after a while. What happened was I was treated at the CHUM for 11 years. The CHUM is Centre Hospitalier de l'Université de Montréal, St. Luc Hospital, and there were 3 hospitals that merged when this new hospital was built. And that's where I was treated for the first 11 years. And then after it was found that I had carcinoma in situ in the ureter, or there were suspicious cells in the ureter, my urologist wanted me to be seen by a uro-oncologist. He was a urologist, but he wasn't specialized in oncology. So she's the one who started the treatment through the nephrostomy tube. But after the first 6 treatments, she left to go to Halifax.
Okay.
So I asked to be referred to because at the CHUM, they hadn't done this treatment. I was the second patient to have the treatment. And I knew that at the MUHC, the McGill University Hospital Health Center, that was familiar with this treatment. And that's where I ended up having, the follow-up. I had another ureteroscopy.
Okay.
So and they found that there was still cancer. So that was when I had the treatments through the chemo treatments. It was gemcitabine and docetaxel.
Okay.
So I had 4 treatments of that. But when I had the 4th treatment, my bladder was so irritated that even with a catheter holding it in, the treatment just came flowing out because my bladder went into spasms.
Okay.
So that was when it was decided that the next step would really be to remove the bladder and the left kidney, which is and ureter, because that was the ureter that had the carcinoma in situ, and there was also carcinoma in situ again in the bladder.
All right.
So it was the right thing to do at the time. My doctor said that, within 2 years it could spread. The ureter is very thin, so if you have carcinoma in situ in the ureter, it can go through it very quickly.
So you had a discussion with your uro-oncologist about what your options were about this.
That's right. And, I'm very fortunate. I have a daughter who's a surgical oncologist, and she's actually at the CHUM, and she spoke to some of her colleagues at the CHUM, and they recommended that this was probably the best thing to do. And this would be the next step in a case like that. So I felt that it was really, everything pointed to that. It was a difficult decision because I think that you imagine all sorts of things, and you imagine that you won't be able to do all the things you want to do, which is really not the case, so I've fortunately been able to continue doing all the activities that I did before. So after the first month, after the surgery, things started really getting much better.
So how did you choose your diversion then?
That also was with discussions with Dr. Kassouf. He suggested that would be the best diversion, that a neobladder with women, in his opinion, was not as successful. It would require sometimes catheterization and a lot of leakage problems at night. And again, my daughter talked to one of the uro-oncologists at her hospital, and he was of the same opinion. He thought, in a younger woman, that maybe it would be an option to go with a neobladder, but that in someone my age, it was probably better to go with the ileal conduit. Okay. So that's what I decided. And really, it's after getting used to changing it every 3 or 4 days, it's really very simple. I did know someone who had an ileal conduit, and he's in his 90s now. And I figured if he could handle it, then I could handle it also. So,
what were some of the learning curves?
Besides changing the bag, some of the learning curves were, for instance, I did a lot of research. And just having to be comfortable with the bag, for instance, so it's not flopping around. Lululemon makes tight shorts, so I just wear Lululemon shorts underneath my pants and it holds it in place. So things like that, doing exercise. I bought a couple of stealth belts to do exercise with, and that helps a lot also. So those were the learning curves, how to keep it dry in the shower. So that was a learning curve as well, just to be comfortable handling the day-to-day issues that would arise. Now I feel very comfortable. I've traveled twice and had no problems whatsoever. So
great.
I've been,
back to normal life as much as possible.
Absolutely, and really very back to normal. I ski. I go to the Y a few times a week. I do yoga. There's some of the yoga poses I can't do where I'm lying on my stoma. I don't like to do that, but you just adapt to things like that.
How long did it take you before you felt like your old self again?
3 months, I would say.
Okay.
By the fall, my surgery was in June, and by the fall, I was really feeling, very well. I was, biking and long bike rides, and really, I was really feeling fine by then.
Coping with all of this can be very overwhelming, not just physically, but mentally. And patients experience fear and uncertainty. What strategies or coping mechanisms did you find most helpful during your journey? And what advice do you have for others facing bladder cancer?
Well, I really did a lot of research. For many years, I've been listening to bladder cancer webinars and BCAN webinars. I've read a lot about bladder cancer. I think information is really important, and I've kept myself very, very well informed through these resources that I found. I also had, bladder cancer almost took a back step because in my life, because in 2016, I also had brain surgery. And I had become, in the space of a week, I had become paralyzed in my right arm and my leg was becoming paralyzed. So, at that point, bladder cancer seemed to be the least of my worries. But I was off work for 6 months, and what was diagnosed as a tumor turned out to be an encapsulated abscess, Staphylococcus aureus, in my brain. So it was removed and took me about 6 months to recover from that. I was off work for 6 months, but in that period, bladder cancer, that was really a major risk to my life. And my sister had bladder cancer over 20 years ago and has never had a recurrence. So in my mind, I think that I was always thinking that my path would follow hers and that it would just be something I'd have my treatments and I'd go about my life as usual. But as I say, keeping well informed was really important. And I listened to a lot of webinars and podcasts, etc.
Did
So
you seek out counseling for any of
no,
this? Because you've been through an incredible journey, especially with your brain surgery and everything included.
no, I didn't seek out counseling. No, I have a lot of family support. Two of my daughters are doctors. They're very supportive. I've also, you mentioned that you had lost a lot of family members or people with to cancer. My sister died. I have another sister who passed away in 2007 of stomach cancer. I have a brother who has liver cancer. My another sister had bladder cancer as well. So we're really surrounded by cancer. I have a nephew who died at the age of 27, after 3 weeks after being diagnosed with brain tumor, glioblastoma, a young doctor. So, it's just something that I think as we get older, there's more and more cancer in our lives. It's just everywhere. So
And we just learn to adapt and cope. Yeah.
just to learn to adapt and cope. My family is very supportive. After my surgery, I had wonderful support, neighbors, friends, former colleagues from work. Everyone was bringing me food. It was really, it was wonderful. Everybody was
Oh,
so supportive. People
sounds
did.
like you're part of a great community.
I really am. I really am very fortunate for that. So no, I didn't seek professional counseling. No, and
Everybody's got a different journey that they follow, right?
exactly. But I don't hesitate to talk about it if I feel, whatever I'm feeling, I don't hold it in. So I do express it.
Well, that's interesting that two of your daughters are in the healthcare system. And I know we all know that the role of the healthcare providers is crucial in your cancer journey. How would you describe your interactions with your medical team and then moving to a new uro-oncologist? And what
Mhm.
made those interactions positive or challenging for you?
They were very good. They were very available to speak to me. Dr. Kessov spent a lot of time with us explaining the surgery and explaining, what his feelings were about the condition and whether the surgery was not the right option. So I really felt that we were listened to and that we were given the right information, and I had confidence, as I say, in the medical teams at all different stages, both at the SHUM and at the MUHC. Very, very good. I felt that I received excellent care.
Excellent. Well, I know it's
Yeah.
very important to have open conversations with your physicians, whether it be your family physician, your specialist, your oncologist. It's always nice to be able to have that open discussion. And it sounds like support around making these decisions are essential. How did you find Bladder Cancer Canada?
When I first started, I remember that there were pamphlets, and I also found information on the net. I found probably on the net or in that pamphlet, Beacon. A friend of my daughter's in the States referred me to Beacon. So as I say, it just flows, and the information just flows from there because both of these websites have a lot of links to other websites and other sources of information.
Absolutely. So I'm sure that, yeah, it's going to come up if you do online research. You're doing your bladder cancer research and your options and looking at what's online. I would assume that Bladder Cancer Canada would come up for you at some point.
Yes, well, as I say, I think it did from the beginning because I started doing the bladder cancer walk in 2016, I think. No, 2015. So I've been aware of bladder cancer for a long time.
Bladder cancer can have a long-term impact on one's life, and it sounds like you have had a long-term impact. How have your experiences with the disease influenced your outlook on life, your relationships, or future goals? And what lifestyle changes, if any, have you made as a result of your bladder cancer diagnosis?
I don't think I've made any lifestyle changes because already I don't drink and smoke. So I don't drink and I don't smoke. So I really didn't make any lifestyle changes. I still do all, as I said before, I do all the activities I've always done. My motto is to do as much as you can while you can in life because there are no guarantees, and I know that from seeing other people close to me pass away from cancer. So I just try and, as I say, do as much as I can while I can.
Except
You know,
for certain positions in yoga.
exactly. But I was skiing in Utah last week, so there you go. So,
Wonderful.
no, but I don't think fortunately for me, as I say, with the BCG, I tolerated it well, other than for bladder. And, I know that from reading that many people have much more serious side effects than I had. Even my sister, when she was diagnosed 20 years ago, she did some BCG and she really had these bad flu symptoms after. I never had that, so I felt very fortunate that I was able to go back to work or work the next day at home and then go back to work 2 days later after all my treatments.
Wow. Wow. You're incredible.
I was very fortunate.
Would you have done anything differently now thinking back over the past decade that you've been kind of dealing with this?
I don't think so because, as I say, I think I had excellent care and was led in the right direction. I don't think there was anything I could have done differently, really. I'm fortunate that I'm still in the shape I'm in after all those years with bladder cancer.
How do you see your role as a survivor or past patient in raising awareness about bladder cancer or providing support to others facing similar diagnosis?
Well, as I say, I've been doing the bladder cancer walk, except for 1 year. I'd say the first bladder cancer walk was the day my first granddaughter was born, actually.
Oh,
And she turned 9 last September. So there was 1 year I missed. But other than that, I've been raising money for bladder cancer every year and trying to raise awareness about it through, when the walk is coming up, I use social media. That has been the main role I've taken in the past. I have participated preparing a guideline for Bladder Cancer Canada or for the Canadian Cancer Society, I'm not sure which, on cystectomies and what patients should expect.
okay.
And I participated in that right after I had had my cystectomy. So I'm always happy to do anything that is necessary.
And just for anybody listening, you can go to bladdercancercanada.org. There's more information and support on the website as well. Susan, is there anything that you were hoping to talk about today that we didn't touch base on?
I really don't think so. I feel lucky to have been treated well enough to have survived bladder cancer. It's not the case with everyone, I know. And I've been surrounded by very supportive family, friends, etc. So I feel like very fortunate in my journey. It's been a long journey, but I've been fortunate that I'm still on the journey, really, because I don't think cancer ever completely goes to sleep. So you need constant follow-up. And I will be receiving that follow-up. So I have a scan scheduled for the end of March and a follow-up with my doctor in April. I just had blood tests, so I am being followed up. I am getting the right care, and I feel fortunate to be able to have that care. I think in Canada, we're very lucky.
Absolutely, we're very lucky. So one last question. You were saying that you have got these follow-up appointments. How do you actually deal with the anxiety going into these appointments and then leading up to the appointments? Because this can't be easy kind of waiting.
I think that you're right. It's not easy waiting for results. The cystoscopies, you get the result. Well, you don't get the result, but you know right away if there's something suspicious or not. What is difficult to wait for are, for instance, if you do have a surgery to remove a suspicious lesion, waiting for the biopsy results. That is always very stressful. Scan results. In Quebec, none of the results are available until 30 days after they've been transmitted to the doctor. Whereas I know in Ontario, my daughter did her fellowship in Ontario, and people could go online right after, right when blood tests or when a scan was read or was when the report was out, and they could get it right away. As I say, in Quebec, you have to wait for your doctor to call you with the results. So you don't get, and I don't even think biopsy results are even in the system. We don't have a good system yet in Quebec for that. So for instance, if I want to see even blood test results, I have to wait until 30 days after they've been transmitted to my doctor in order to be able to consult them. My daughter is of the opinion, though, that prevents people from panicking before their doctors even had a chance to talk to them. So there are two sides to it, to the story. For in some instances, it's probably beneficial because patients are not always in a position to interpret the results the way the doctor could if he was giving them the results. But it's a long wait. It's always a long wait.
And how do you deal with that, like mental health wise?
Try to go about life as usual.
Okay.
It's really, there's nothing you can do about it, really.
Right.
So you just have to, carry on, try not to let it get to you.
Absolutely. One day at a time and leave that until, when it comes, and one step at a time. Sometimes it's 1 minute at a time. You got to go through it.
Exactly. Somebody said to me, there's no point in worrying twice. You worry until you get it, and then you worry once you do get it, if it's bad, or maybe you worried for nothing if it's good news, so you have to try and live by that maxim. So
No, I like that. I like that. Thank you very much. That's excellent advice. Susan, I wanted to thank you so much for taking the time to speak to Bladder Cancer Canada on the podcast today. We are praying for you and wishing the best in your health and recovery and remission. And hopefully all your results come back positive. Well, negative.
Negative.
All negative. Yes. Yes. You know what I mean.
Well, it was nice meeting with you, Summer, and it was nice chatting with you. Thank you.
Thank you. If you or someone you know has been diagnosed with bladder cancer Canada is here to help with support programs, informative resources, and educational sessions. Visit us at bladdercancercanada.org to access these resources and to share your story. Be sure to follow us on X, Facebook, Instagram, and YouTube. We will respond to messages sent on socials. If you are a bladder cancer patient or survivor and would like to share your story on the podcast, please contact us at info@bladdercancercanada.org.